And we're back talking about denial, talking about diabetes. My special guest is Larry Boggs, who is an expert in the field of diabetes. He is a diabetic. He's done an awful lot of research that he shares with all of his constituents. And we were talking a little while ago about a family member and denial.
Correct.
Okay, so this family member never pricked her finger, completely stopped taking the test.
That is correct.
And you're supposed to take them how many times a day? Once a day, twice a day? How many times a day do you take them?
I take mine 8 to 10 times a day.
8 to 10 times a day. So this is something you actually carry in your pocket.
Not in my pocket, but it's in my car
It's
right
in your
now.
car.
It's
Okay.
with me at work. It's with me at home. I
So-
always have it available.
So after a meal, before a meal, you just take your...
I check 20 to 30 minutes before a meal,
Okay.
and I will adjust what I eat as far as carbohydrates based on what that reading
What
was.
the reading is.
I try to take it 2 hours after a meal because you should be back in a normal range within 2 hours.
And your normal range is what?
My 90-day average is about 128.
Okay, 128. Let's go back to denial. Those people that will not do what you're doing, that you know. And you were talking about your wife's sister.
Correct.
Okay, what is her condition right now? Where is she at this point?
She's developed glaucoma. She's developed tunnel vision. She's having a huge problem with her eyesight. If she eats big meals, which she eats what she wants when she wants, whether it's sweets, whether it's breads.
But this is pretty typical of a lot of people, not just, I mean, don't a lot of people find themselves just doing what they want to do?
That's correct. Most people don't take diabetes seriously until they develop complications. And then it's, why me? It's, they can't understand what's happened and why it's happened to them. Most of those people, it's either one, they have all the diabetic symptoms and they know they have a problem, but they don't go get diagnosed because they don't want to accept the issues. Or it's people that have been diagnosed, as my sister-in-law, who she told my wife, the last time my wife brought it up was over 6-7 months ago.
So she doesn't even want to talk about it.
She doesn't want to talk about it. She'll get mad and she's off the phone if my wife starts to talk about it. My wife asked her, what do you do? How do you know if your blood sugar is high if you don't take it?
Right.
She goes, I know when it's high. It makes me feel funny and I get really sleepy or I get a headache. And
she
you
just
know,
go take a nap
she goes,
and go to bed?
I just go take a nap for about an hour or two and I'm fine when I wake up. I don't need to take medication.
But Larry, that's very typical of millions of people, because you have sent me information on the denial syndrome. People
Correct.
that won't go to the doctor and won't be diagnosed. Now, I don't really understand that. What is your diagnosis on people that just, we don't want to call them brain dead. We don't want to call them lame. I mean, is it, acceptance is tough.
That's not just with diabetes, though. That's with everything in life.
Well, that's true.
There are a lot of people that don't face complications or don't face issues in their life very well.
Until they get to
And
a
you know, one
serious
of the problems, and we touched on it earlier, is the fact that there are a lot of doctors who know very little about diabetes who are now diagnosing patients with diabetes, but yet they don't know how to deal with it.
Let's talk about that, because you used the word a little while ago. Endocrinologist, what is that word you just used?
It's an endocrinologist.
Endocrinologist.
Correct.
And what is that?
That is a doctor that is very specific in treating the endocrine system. Various things that make your body function. It's diseases that deal with blood,
Okay.
deal with your kidneys, your pancreas, your thyroid.
And say it again.
ENDOCRINOLOGIST.
And what's the difference? You just gave me the difference partly between a regular physician and an endocrinologist. They specialize in the blood, right?
Correct.
Okay, do I have that right? So if an endocrinologist is going to have more information about how your diabetes is reacting, why should you go to an endocrinologist?
Not only is he going to have, he's going to see how you're handling the diabetes.
He's going to see how
and
you're
he's
handling
going to know how to treat your specific case.
Okay.
There are a lot of doctors that you know, there are a tremendous number of general practitioners. that will treat diabetes, but they treat diabetes like it was a cold.
That's right. You had a cold before you were
They're not
diagnosed.
concerned about how often you take your blood sugars. They're concerned about, take this medication, keep them in a generally normal range, and you should be fine. If it gets out of hand, we'll deal with that, as long as this takes care of it.
General information.
Right. That's what they deal in
general...
generalities.
All right.
And so subsequently the problem of denial is actually exacerbated somewhat by people going to non-specialists, because a lot of those non-specialists are the ones that give the diagnosis of prediabetes. And so they give the person the impression that even though your blood sugar is high, you don't have to worry about it now.
Right, right.
If they were very proactive about it at that point in their life.
Which is what they really should be from the very
correct.
beginning.
If they were very proactive from the very beginning at that point, they may avoid complications of diabetes, medications, all of those things for the rest of their life. Typically, though, people are not proactive until it becomes a serious problem.
And at that point, it's really too late.
That's correct. You cannot reverse the damage.
Okay, so
some of the things that happen that cause damage, or some of the things that are damaged, you have nerve damage because of the lack of blood flow, causes amputations, causes kidney failure, causes strokes, causes heart attacks. It causes blindness.
Yeah, blindness is becoming very, very common. We want to talk about that.
That's correct.
But why is it that I hear a lot of diabetics will have a toe removed, or will have it seems to start, the amputation seems to start in the lower part of your extremity?
They start in the extremities, and the far reaches of the extremities, because that's where the tiniest blood vessels are.
Ah.
And as those blood vessels dry up and quit delivering blood to that area,
and your feet start turning blue or black?
Well, typically what happens, your feet will start turning blue or black, but typically what happens that causes amputations is you will start to lose your feeling. The nerves will die off. You will have no feeling.
So it becomes numb, or you just don't have any feelings?
You have no feeling.
Is that erratic? I mean, just that quick?
No, it's not quick. It's over a long period of time. But until you realize that you can't feel it anymore, you don't pay any attention to it.
It's diabetes, and we're talking about diabetes in America. The name of the series is Time Bombs, because that's what Larry so affectionately mentions, those people that are not diagnosed with diabetes. And we haven't even gotten into the children and into young adults that are now being diagnosed with diabetes at a very, very young age. This is a two-part series. This is only part one with Larry Boggs, and you don't want to miss part two at all.